Right. Yeah, and the problem is a lot of people use the nasal steroid spray wrongly. So if I ask a patient, you know, how would you use it? The instinct is always to do this. So they tip the head back, and I've got one here, and they shove it up their nose or into the middle of the nose, and they spray it, and then they go and basically swallow it. So it doesn't work because it's actually then being swallowed. It's not going to sit there. So what you should actually do is give it a bit of a shake. Put it in a nostril, put it towards the outside of the nostril, tip your head forwards, so you're putting it in like that, and you're actually going to spray it, and then just breathe normally. So you're actually just inhaling it rather than swallowing it. And I've had patients where when they've done that, they come back and actually say it works. But the problem with these is they don't work straight away. It takes about 2 to 4 weeks to get in your system. So again, if you think you're going to struggle with nasal symptoms and eye symptoms, start that now, because in 2 to 4 weeks' time, the pollen count will be high.
I was just thinking about you talking about the medication there, about antihistamines.
Yeah.
Do you have to get branded ones? Because I think if you have to take for a couple of weeks, it's going to add to the expenses.
Yeah, and you know,
do they have to be expensive?
We've just seen a VT there, haven't we, about pharmacies, and you know, there will be lots of adverts in pharmacies for really expensive branded hay fever medications, and I would say I don't buy those. I would say go to a supermarket, pharmacy, just look at the active ingredient, and that's the same for all medication. Yeah. If the active ingredient is the same, so if it's loratadine, cetirizine, whatever it is, it doesn't matter if it's a fancy brand. The cheap ones are just as good because it's the ingredient that you need.
So you're talking about pharmacists there. Can you go to your pharmacist then to get the right medication?
Yeah, I mean, pharmacists are great, aren't they? Look at everything they've just been doing on